Hey everyone, ethical consideration in nursing. That's what we're going to be dealing with today. Yes. So excited to discuss this with you today. But a brief introduction. Thank you so much, my subscribers, for always supporting me. You are reaching the 5th floor. That's like the 50th subscribers we are looking at right now. We are actually at the 47th, and I'm sure that you're going to bring more people. You're going to discuss this channel with your friends, and you're going to subscribe, and we're going to grow this community together. Thank you so much. I appreciate the love and the support. Now, if you're watching me for the first time, you're welcome to Nursing with Abby. I'm Nurse Abiodun. I'm a nurse, I'm a midwife, I'm a public health advocate, and I love what I do. Now, in this channel, we talk about nursing, we talk about lifestyle, and we talk about everything in between. So I would like you to do 4 things for me. I'd like you to like this channel. I'd like you to share with your friends. I'd like you to subscribe, and I'd love to see your comments in the comment section. Even if it means hashtag I like your voice, or hashtag I like your background, or hashtag I like your hair. Just comment so that I can know that somebody is watching with me and somebody is interested in what I have to say. Thank you so very much for the support and love thus far. So we delve right into the topic for the day. Now we're talking about ethical considerations in nursing. Now, a lot of us know about this in nursing school, but I really just want to re-educate us about nursing, ethical consideration in nursing, because but in the previous decade, there's not been so much ethical consideration, especially in developing countries. But in this decade, a lot of people know their rights. A lot of people know that a nurse should not do this or do that, and if any of those rights are infringed upon, there could be legal implications to them. And so your code of conduct and your ethical consideration knowledge would help you to know what to do and what not to do. And you also need to ensure that you follow the protocols of your local policy strictly, so that you're defended both at the local your local hospital, and you're also defended as a nurse with your regulatory body, which is probably Nursing and Midwifery Council in any state that you practice in. So I'm going to be talking about 7 of those ethical challenges or ethical considerations today. Now I'm going to start with the explanation or definition of what ethical code of conduct or ethical consideration means. They're actually moral principles that govern the way a person or a group of people have to behave or conduct themselves. Okay, so it's a general thing. So in all nursing departments or not all nursing organizations or institutions, these 7 ethical considerations must be followed. So it's not different in Nigeria to Europe to Germany to Canada. It's all the same. And also it pertains to the right and wrong actions, or encompasses decision making, which determines the ultimate consequences of those actions. So is either right or wrong. So if you follow the ethical principles very well, then you're right. If you do not, then you're wrong. So the ethical principles are the benchmark that you use to decide the rightness or the wrongness of a particular action or inaction. Okay, so let's move right into autonomy. Yes, autonomy. That is the right of a client or a patient to make their own decisions based on their own beliefs and values. Now, you have to give the patient the exclusive right to make decisions. Now, you could come in as a health professional to explain the disease condition the person is suffering from. You could explain the effect of such disease condition on the patient's maybe body system, or the ability to live, or the ability to live their life successfully. And you could also explain the various treatment modalities that are available to help to cure or treat or probably alleviate such disease condition. But it is the exclusive right of the client or the guest to decide, to choose which one he or she wants. Okay, and some people can even refuse. You cannot do anything about it. All you just need to do is, after due education, you don't coerce, you don't force. Okay, you don't force anyone to take any form of treatment. So a patient has the right to refuse treatment. A patient has the right to refuse medication. A patient has the right to refuse any form of medical intervention, even if it has a detrimental effect to the person's health. But it's important for us to know that the person we are talking to is mentally okay, and we can also be sure that the person is in the right frame of mind. Let me put it that way, okay? So an example is a DNR. A DNR means do not resuscitate. So if you have a patient in a life-threatening condition, or maybe it's in comatose because of a road traffic accident, and the nursing instinct in you just says resuscitate. But as soon as you see that DNR on the person's bracelet or the hands or the neck, you don't resuscitate. That's very difficult, isn't it? Like just watching somebody's life slip out of him or her just because the person refused resuscitation. Well, that's the person's choice, and we have to obey them. Now, the next thing is beneficence. Yes, beneficence. That means doing good. Now, you have to do good. You have to balance the benefits of a particular treatment against the risks. Okay? Now, for example, if you have a pregnant woman who probably has a condition that might affect the health of the baby, and probably the drug also has some detrimental effect also to the woman, you're going to weigh the consequences of, okay, let's see, maybe we can help the mother to deliver this baby first, and then we start treating the condition, because treating the treatment can have any adverse effect on the patient, on the fetus, let me put it that way. So you want to look at, okay, let's see if the woman can still manage with the condition till delivery, and then we start treatment for the mother, or we'll risk giving the woman the treatment and then risk having the baby adversely affected. So you have to weigh the benefits to the risk. So it's important for nurses also to know this and then communicate effectively to the patient. They should be in the know of whatever decision that you feel that you want to lay on the table for them. Let them be aware. Okay, even if possible, having to sign a consent form that, okay, I decide that I will delay my treatment until my child is born, so that is legal and binding. Okay, then another thing is that you must ensure that you refrain from anything that can cause harm. So that is why safety is a very important integral part of nursing care and practice. Okay, if you know that a patient is at risk of falls, a patient is at risk of mental non-alerting situation, or maybe the person is on a drug that is that can affect the mental capability, you must ensure that you have your side rails up, because if such a patient, out of the aggravation of the condition, falls down because the side rails are not up, you are going to be sued for negligence. So you have to make sure that is important, even for children. Now we also have justice, and justice means just fairness, equity. Now, you don't treat a person nicely because he's rich, and you treat another person poorly because he's poor. You don't treat a person highly because of his status in the society, and then you behave nonchalantly to another person because he doesn't have a name in the society. Everyone has to be treated equally. Now, there is a question in Nursing and Midwifery Council that said that if you have a prisoner having a gunshot wound, and you have to care for the prisoner, and the prisoner is crying for pain, do you just shut the prisoner up and say, look, I'm not the one that brought you here, just deal with yourself? Or you check into the patient's charts and check whatever medication he or she is on and administer the medication as if you are treating the president of the country? So that is how it should be. You should treat everyone the same way. Your nursing care action has to cut across races, cut across status, cut across the position of such a person in the society, either rich or poor. So you have to treat everyone equally. The next thing is non-maleficence. That means do no harm. Do no harm. Do no harm. That's quite difficult, because there are some ethical dilemmas that you find yourself in, that the patient refused medication that can save the person's life. At that point, though you have the ethical consideration of non-maleficence, but you have to obey the patient's order, which is, I don't want medication, I don't want to get better, I just want to live the remaining part of my life peaceably. For example, a person who had undergone mastectomy in the right breast, and after 2 months, the mastectomy site has aggravated, and the breast cancer has gone to another side of the body, and then we are asking her to come for another one, and she said, no, let me just die peacefully. And probably with chemotherapy and a few other treatments, the person can still survive, but she's hell-bent on saying no. There's nothing you can do about that, because you really need to obey your patient's orders. Now, the next thing is accountability. Now, this is very, very important. Accountability is very important, because as nurses, we are given the opportunity to delegate some of the tasks to LPNs, that's licensed practice nurses or nurse assistants. But all those tasks must also be supervised, overseen, and make sure that it is done to the best. Because if any of them have issues with the task given to them, you are accountable as a registered nurse. So you have to ensure that the person that you're delegating such responsibility to has proven competence in that action, and the person is also probably versed in that situation or have done it before and you've watched. And you should also ensure that they document all that they have done, because if there's any issues, then the nurse is accountable. Another one is fidelity. Yes, fidelity. That has to do with what? Making sure that you keep your promise. Okay? You keep your promise and you're faithful to provide high quality care in a safe and competent manner. So whatever that you're doing for your patient, it has to be valid. It has to be, you should make sure that you follow the nursing code of practice. Okay, and you should not be too familiar with patients, because a lot of them just take advantage of that. So you have to be true, you have to be firm, you have to be truthful, you have to make sure that you're keeping your promise, be faithful, but you have to be firm. And don't be too close or too attached to a particular family or a particular patient. Okay, yes. So the last another list is veracity, and veracity means being truthful. Being truthful even if it may cause the patient distress. Now, that truthfulness is very important, because a lot of people do not, they bring in their values or their own deep-seated beliefs to nursing. No, you have to be truthful. If a procedure is about to be carried out on a patient and you know that this procedure is quite painful, it's important for you as a nurse to communicate the level of pain that such a patient may experience. You could also advise on some medication that the patient can use to probably relax the patient. For example, a patient going in for magnetic resonance imaging, MRI. Now, you have to ask the patient if the patient has a case called claustrophobia. That's fear of spaces. Fear of spaces. So it's important for you to know if such a patient has history of claustrophobia in him or her, or with history, that it's important for you to give something like a light sedative. Those informations are very important, and you have to be truthful to your patient on what to expect during the MRI. Okay, so those are the very important things. So as a nurse, you have to be truthful. Even if the test or the procedure is going to be painful, you need to let your clients know, and then they are prepared. You could even give some tips as to how to cope with the pain. For example, a woman for vaginal examination, which is quite painful, you have to explain to her that they're going to poke in their hands into your private part, and it could be a little discomforting and painful, but you can pant and breathe in and out, stay still while the procedure is going on. Now, the patient is aware already, and you're giving the patient some relaxing techniques to help to ease the pain and then make the procedure seamless. Okay, so those are the 7 ethical considerations as a nurse. In case you remember any more, please put it in the comment section. I'd love to see it. Or in case you're faced with a dilemma and you were wondering what could have been done about that situation, or you were not even happy with the outcome of that, please, I'd like to see your comments in the comment section. Let's grow this community together. Let's learn together and let's grow together. Thank you so much for another episode of Nursing with Abby. I'm so fascinated having this conversation with you guys. So please ensure that you like, share, and subscribe. Share with your friends, and let us grow together. Till I see you in my next episode of Nursing with Abby. I'm Nurse Abiodun. I talk about nursing lifestyle and everything in between. See you then. Bye for now.